This afternoon, health experts are calling for an outright ban on the hunting and sale of bats in Ghana as the country rallies to respond to the outbreak of the deadly Marburg virus. At least 2 persons have been killed by the virus, with close to 100 contacts placed under strict surveillance. The country's response program to the disease has been threatened by widespread ignorance of the condition among the population. The Ghana Health Service says it is on a hunt to unravel the source of the virus in the country. Dr. Franklin Esiedu-Bekwin is head of public health.
No, for now, the source of the infection is not known because there's a history of the first one coming from Western region. We are trying to go further down to the community. There's nobody there who is sick, but what we are trying to do is that all persons in that small community of hamlet will also bring up on board as contacts. You see, if you look at the disease transmission or spread, is zoonotic in nature. So it could be from an animal to any of these persons, or could be from another person. For now, we keep on exploring. Hopefully, we'll get it.
Dr. Esiedu-Bekwin also says the service has activated a containment plan to prevent further spread.
The outbreak is more of a local or localized outbreak. So the intervention tends to vary. So you have to have a higher dose at the area affected as opposed to the whole country. So the concentration has been more to the affected areas where we are focused more on the risk communication. But we are not going to expand so that the other parts of the country has information. Our main goal is containment at source, so that we don't want to spill over to other districts. We have had a lot of, we are actually doing this response with our partners. And the issue about risk communication is going to be rolled up to the nation so that people in Accra, Takoradi, hear about it.
And that was Dr. Franklin Esiedu-Bekwin, head of public health at the Ghana Health Service. Even as this continues, virologist at the Kumasi Center for Collaborative Research, Dr. Michael Owusu, is cautioning people to stay away from bats, avoid hugging and handshaking.
Animals that are high risk, the bats, which are mostly likely to carry this. So if you have to put in any restriction, I think you are better off putting restriction on the bats. And the point is that, yes, if you cook the any bush meat and you eat, those eating will not have a problem. But then eating means that you create the market for those who hunt and process it. And this is how you look at it in the bigger context. Okay. So if people are eating bats and you tell them that, look, limit or stop eating bat at this time, those who catch or hunt for this bat will not do that. They will switch to other animals that are less riskier. So you are looking at those eating and then those supplying. And if you want to dig the supplier, then of course you advise those eating to limit it, and those supplying will actually manage. So,
Meanwhile, Director General of the Ghana Health Service, Dr. Patrick Kumar-Boakye, says 13 out of the 98 persons quarantined have tested negative for Marburg.
We've had 98 contacts, health workers, mortuary workers, family members in Adansi and also in Savannah. And we follow them. About 39 of them completed their quarantine, which was an incubation period between 2 and 21 days. So of the 98 contacts, we have randomly tested 13 of them, and they've all been negative so far, and we don't have anybody. We have general surveillance for all conditions and all, including that, and that's why the system was able to pick it up early.
Director General of the Ghana Health Service, Dr. Patrick Kumar-Boakye there. Let's stay